They blame it all on my mental illness or my drug use or my alcohol use, and then I stop my drug use and my alcohol use. Then they put me on medication that doesn't work. And like there's like serious side effects where my body's shaking all the time, like my hand hurts all the time.
That was Carlos. He says that he's been experiencing homelessness his entire life, and he currently lives in Cesar Chavez Plaza, and he's what experts in medicine and public policy call a member of the revolving door. So here to talk about what that means and solutions for it in Sacramento is Devin Truvy. Devin, what do we understand the revolving door to be in this context?
Right, so it's a person experiencing homelessness that goes into the ER for care, only unfortunately to have to return to the streets and then back to the ER for continuous care in situations like that. Now, for those repeat patients that come back as many as 4 times in 90 days, only about 1 in 10 have housing, and 39% of the unhoused repeat patients, they have substance use issues. Now, some of the solutions that doctors from UC Davis like would be resources to enroll them in long-term outpatient programs, but they need more, which is why Sacramento Mayor Darrell Steinberg was also a part of the conversation today to address how the new city-county agreement can help.
Navigate them to a core center, a county-run mental health center as opposed to an emergency room, to have the beds to back it up. Then we have a much better chance of helping people actually succeed and cleaning the city.
And there was a big focus at the seminar today about the myths surrounding the unhoused community.
Yes.
And their want to get medical care. You know, some say that they're refusing care, they don't want help. Is that true?
Well, Dr. Amy Mullen, who was the speaker there, she also is an ER doctor at Davis, where all this data came from, and runs the substance use program there. She'll tell you that's simply just not true. And people experiencing homelessness who come into the ER and get enrolled in one of those substance abuse programs, 67% of them will come back for follow-up care. That's people like Carlos, who you just heard from earlier, but also, again, hyper-local data straight from the Davis ER over this entire last year. So it's our local population.
And it really goes against the idea that people think that, you know, unhoused people are filling up the ERs, right?
Right, absolutely. 95% of people in those ERs, that's people like you and me. Only 5% are from the unhoused population. Yes, they are likely to be those repeat patients, but doctors will tell you that's a lack of resources, not the homeless taking up space and increasing your wait time. Their complaints are the same as you and me: shortness of breath, abdominal pain, all things you and I would go to the ER for. So Mayor Steinberg said it best: the fact that homelessness and those experiencing are in the ER reflects a failure in the system. That is where they go to fill a prescription, where you and I would go to the pharmacy. They just need more resources.
All right, Devin, thank you for following this. We appreciate it.